Up next, OCD and me. Addie has been working in the mental health field in acute psychiatric care, community health, and peer support since 2015. She is a wife, mother, and social worker. She managed to navigate life, school, and motherhood before she realized there was help for managing her obsessive compulsive disorder. Her presentation, OCD and Me, a social worker's lived experience, will cover some of the symptoms of OCD and the cultures and core beliefs that keep individuals from seeking help. Please join me in welcoming Addie to Real Voices, Real Choices.
So my name is Addie Blankenship, and again, thank you so much for joining me today. My presentation is going to be OCD and Me, a social worker's lived experience with obsessive compulsive disorder. So again, thank you so much for joining me. Just a little bit about me and introducing myself. I am a mother of 4 children. I am also a wife. My husband and I have been married for 14 years. We live in Southeast Missouri, and I really enjoy my family. I enjoy spending time with them, doing a lot of fun things with them. So I enjoy that. I'm also a social worker. I have my MSW and enjoy being a clinical social worker. Other things I like to do are I love to paint and do crafts. Kind of nerdy, but I still love it. I love to travel. I have family in the UK, so I travel all over. I've been to Ireland and London and Mexico and planning a tour to Italy soon. So I'm very excited about that. I just love doing that. I love animals, dogs, cats, birds, rodents. I have them all at my house with my kids. So I also enjoy that. I love to read and I love to learn. I love school. I loved working on my master's and my undergrad. I really just enjoyed that part of my life. So now that you know a little bit about me, when I introduce myself, I usually start with all those things. And then I also add, and I struggle with a mental health disorder. And at that time, that's when I kind of lose the person in front of me and their mouth drops and they look at me and say, well, you don't look like someone who has a mental health disorder. And I've actually had professionals say that and other acquaintances say that. And I'm like, yeah, I actually am. Let me share about what I struggle with. So I'm going to kind of give you an in-depth look at that part about me. My primary diagnosis is obsessive compulsive disorder. So I feel like OCD is a very misunderstood diagnosis. It's almost, we all know that there's stigma surrounding mental health. And I feel like the stigma with OCD is kind of on the other end of the spectrum. People don't think it's a serious issue. Some people make fun of it. Some people think that it's actually an asset to someone's life rather than a disorder. But so we're going to kind of break it down just a little bit. Obsessive compulsive disorder is under its own category in the DSM-5. It's kind of in that area with body dysmorphic disorder and some other very specific disorders. It looks very different for each person. The types of issues someone may have when they are suffering from OCD is really going to vary from person to person. But usually it's indicated by the presence of unwanted intrusive thoughts. This is what we call obsessions. Usually in my presentations, I'll refer to obsessions as intrusive thoughts, but they are one and the same. They're interchangeable. Obsessions, as I said, can look very different from one person to the next, but usually they're really scary images or compulsions driven by anxiety that are repeated over and over. So an obsession is going to be something that someone who suffers from OCD, they just can't get it out of their mind. They try and it's like their brain is stuck on this thought. It's usually a scary thought or a thought that causes them anxiety. And then the other piece are compulsions. And you'll hear me use the term rituals a lot. That's what I have always called them. So compulsions and rituals are kind of interchangeable as well. So a person with OCD may have obsessions and compulsions, or they may just have obsessions and you may not see the compulsions. So as I said, it can look very different for everybody, but it is usually very, very distressing and cause a lot of anxiety to a person. Let's see here. So kind of to explain my experience with OCD, I remember my very first memories when I was a child. I think I was 7, 8. That's kind of the memories that I remember. I remember that these intrusive thoughts in my head. And when I say intrusive thoughts, I'm not talking about auditory hallucinations or anything like that. It was just a thought, a scary thought that was in my head. And a lot of these scary thoughts focused around checking and rechecking. I remember when I was little, I would wait for all my family to go to bed. And when everyone was sleeping, I would get up and check every lock, every door, every candle, every light switch, every power outlet, because the obsessions would tell me that if I didn't check those things, my family was going to get hurt or die. A fire would start and it would be my fault. Someone would break into the house and it would be my fault. So the obsessions would tell me, if you don't do these rituals, if you don't do this and this and this, something really bad is going to happen. And that caused a lot of anxiety. So the checking and rechecking were my compulsions. Another thing that I experienced when I was very little was checking my siblings and having a very unrealistic expectation of caring for my siblings. So when they would all go to bed and I would be up doing my checking routines, which would be several hours into the night, I would also check the necks of my brothers and sisters to make sure that there was nothing that would choke them in the night. The obsessions told me that I was responsible for making sure they didn't die or they didn't get choked or that there wasn't a necklace around their neck. So that was part of also my obsessions. And the obsession was me feeling like I was responsible for their lives. Also, the culture of my family was very religious and very spiritual. So a lot of my obsessions and compulsions were morality based. What my family and culture and religion deemed as sinful or deemed as shameful, I would have obsessions about those things. And then I would do the compulsions to try to sanctify myself or clean myself or not to be in sin. And sometimes that could take hours and hours, whether it be praying or whether it be washing my hands a certain number of times or doing certain rituals. The obsessions would also focus around our religion. As I grew older and as I kind of grew into middle school, elementary school, the obsessions kind of changed. I started to really fear germs and really fear food contamination. So there would be times where I would try to cook something for my family, or I was learning to cook, and the obsessions would tell me that there was germs in the food and that if I fed the food to my family, they would get hurt or they would die from a germ. So I was very, very scared of that. And I was very careful about the food that I would prepare. It eventually got so bad as I grew older and older, and I'll go more into this, but it got so bad that I just would stop cooking for people because I was so afraid of the contamination. Another example, and with OCD, there's not a lot of logic between the obsession and compulsion. So I would have obsessions, say, about my husband getting into a car wreck. And somehow I was responsible for that. So the compulsion that I had to change my clothes every time I had a bad thought. So there's not a lot of logic between those obsessions and compulsions. So sometimes it would be very obscure. There really was no link between the intrusive thought and what I thought I had to do to relieve the anxiety. So sometimes the obsessions and compulsions can kind of seem like they go together, perhaps like with morality-based OCD. If you do something sinful, you have to pray a certain amount of times. In my case, that wasn't always accurate. Sometimes they were very odd and extreme, and they didn't really have much logic to them. So the myths of OCD. Growing up, I didn't really know I had OCD. That came later. But when I did finally get my diagnosis, and I'll talk more about that later, a lot of people treated my OCD like a funny quirk. They would say things like, wow, you're so lucky to have OCD. You must be a really good student. Wow, your house must be really clean. Wow, I bet your clothes are organized in color coordination. Yeah, I'm so OCD about that too. People would say things like that were really demeaning and hurtful. And I don't think people realized how much distress it caused. OCD is a serious anxiety-based disorder. It affects the way people live and work and have relationships and enjoy life. A lot of people that I have met in my time as a social worker have had to quit their job because of such severe OCD, or perhaps they had to quit school, or they find life and relationships extremely difficult. So it causes a lot of anxiety and distress for people. As I said, at the age of 7, that's when OCD kind of swept in and took over my life. My obsessions and compulsions did cause a lot of pain and suffering, but I was really good at hiding it. So I kept it a secret for a really long time. And it even caused very, very much discomfort and suicidal thoughts and actions, which we'll get to in a little bit. So why? Why do we keep this hidden? This is something that I've reflected on in my own life, and I've also talked to a lot of people with this diagnosis, and I've kind of come up with a few things that I find really similar in the people I've talked to and in myself. Personally, the culture of my family made it so hard to share about what was going on inside my head. Sometimes the obsessions were so obscure and weird. Culturally, it just wasn't acceptable. So I couldn't talk about it. Religion also played another huge role in why I didn't share about what was going on inside my head. The attitude of our religion and also our culture was that God would heal things that were wrong with us. So finding medication or going to a doctor wasn't really an option. It was kind of taboo. It was also seen as a lack of faith. If you had anxiety or abundant fear, that was something that they told us, you must not have enough faith. You must be faithful if you're or faithless if you're fearful, kind of thing. So that's another reason why I didn't feel like I could share. Fear was a huge issue for me. I was afraid that I would be thrown into an asylum or an institution. I was afraid that social workers and therapists would come take my children from me if people found out what kind of thoughts were in my head. I was very afraid of my family maybe disowning me and not wanting to be a part of my family anymore if I were to share about the struggles I was having. Shame was another thing. This kind of relates back to the culture and back to the religion, but shame was a huge part of the reason why I kept my symptoms hidden. I was ashamed about the thoughts in my head. I was ashamed that I couldn't control it. And I was really ashamed that I perhaps wasn't good enough, or didn't have enough faith, or didn't pray enough, or wasn't a good enough person to overcome what was happening inside my head. So shame was another issue. Guilt. So I kept my OCD hidden for fear of one of the obsessions I actually had was I didn't want to share, and I didn't want people to think I was sharing and lying about it and just wanting pity from them. I felt guilty about that. I thought there are so many other people in this world who are going through so many things. I don't have any right to share. So because I felt guilty, I kept it hidden. And then lastly, the OCD told me to. OCD isn't like perhaps schizophrenia or a delusional disorder where you hear things that aren't there or see things that aren't there. But OCD is thought patterns in your head. So when I personify OCD, I kind of explain it like a monster, and the monster would tell me things that were very scary. And those were the thoughts in my head that were very scary. And OCD kind of knows, if I were to personify it, it kind of knows what your deepest, darkest fears are, and it plays on them. At least that was my experience. And sometimes the OCD would tell me I couldn't share because my family would disown me, or something horrible would happen if I were to talk about the distressing things in my head. So I came to a point where things weren't getting better. In 2015, my untreated mental health disorder drove me to the point where I almost took my life. My family is very loving and very supportive, but they didn't have a lot of information. As I said, in the culture of our family, mental illness wasn't something we talked about. At this point, my brain had been so bogged down and so tired that I stopped doing compulsions, and I started to only focus on the obsessions. I would lay on the bathroom floor and I would struggle to just even get up and eat and to communicate. And my family didn't know what was going on. Sometimes I would lay on the bathroom floor and hit my head against the toilet because I just wanted the thoughts to stop. So it was very scary for all of my family. Kind of putting this into context about the culture of my family. My husband was working at the time. He had sent the kids to one grandma's and sent me to my mom's house, and he thought maybe I needed a break. Maybe I just needed some time, so he sent me away. And at that time, extended family started saying rumors about me. Well, Addie left her husband, they're getting a divorce, all that stuff. And I just remember hearing these things people were saying about me, and I was actually okay. I was like, you know what? If they're talking about me getting a divorce, that's so much better than them knowing that I may have a mental illness, that there's something going on in my brain. That's how shameful mental illness was in my own mind. We had gone to my primary care doctor. We had done every test, every scan. We did so many thorough testing, and my doctor would come back to me and say, "You're the healthiest 27-year-old I've ever met, Addie. There's just nothing wrong with you, like a tumor." And I just remember crying because I just wanted a brain tumor before I would admit that I had some kind of mental health issue going on. I wasn't able to talk about suicide openly at that time in my life when my symptoms were very acute, and I was very much struggling with those obsessions that were really heavy. I was very suicidal, but I couldn't talk about it because of the culture of our family and because of the religious implications it would have. So I kept it inside. I couldn't ask for help. I didn't know how to ask for help. It was a sin to even contemplate. So I felt very trapped and very alone. I was terrified of psychiatric help in the mental health world. I didn't know anything about it. I'd never met a therapist or social worker in my life. I didn't even know what a psychiatrist was. And I was just terrified of what they would do to me if they got their hands on me. So I refused to reach out to medical professionals for help aside from my primary care doctor. I was afraid of medications. I just remember thinking that the medications would somehow change who I was. Maybe the medications would make me too sleepy and I couldn't be a good mom. Maybe the medications would make me addicted to it. I didn't know, but I just knew that I couldn't chance it. I did not want to take medications. And then finally, I was so afraid. At this time, I was a mother. And I was so afraid that social workers and therapists would come take my children away. I thought I was the only one going through this. They couldn't possibly understand, and I would lose my children because I was such a bad mom for struggling with these things. And that leads you to a very hopeless and a very lost place. So, the change is what I call it. The change happened when I got to the lowest place of my life. And I got to a point where I had all these wonderful things. I had my family and I had my children and I had I was in ministry and I had a degree in theology, and everyone looked at me and said, "What is your problem? You have everything you could ever want. Why are you doing this?" And I couldn't answer that. I didn't know what was going on. So the good things of my life were slowly about to be outweighed by the intense distress that my mental illness was causing on me. And again, at this point, I didn't know what was going on. I didn't know that this was a mental health condition. I just thought that I was a complete failure. So at this time, I was contemplating ending my life. And I remember very specifically, I was sitting out in my parents' orchard, and I was sitting on a bench. And as I said, I was religious. I am a person of faith. And at that time, I was talking to God. And I just remember being so over it, so over the pain and so over the drama and the unknown, and didn't know what was going on. I said, God, if you want me here and you want me to continue this life, you're going to have to do something, because I don't have it anymore. I don't have it in me anymore to take one more step. And at that time, and this may be silly to some people, but a little cardinal came and sat right down by me on the bench in the orchard. And it was as if that's my sign. A lot of different people have a lot of different signs, and I think that was mine. And that gave me just enough hope to say, okay, I'm not going to end it today. It was at that time that I decided to go to the hospital. I didn't know where I was going. I didn't know what I was doing. My primary caregiver was not educated enough about anxiety and OCD and mental health to know what was going on. So I didn't trust him. So I went to the ER. And it was very scary to take that step. And I wasn't honest. I wasn't honest about how I felt. I wasn't telling them that I did contemplate suicide. I didn't tell them about all the really heavy, obscure, obsessive thoughts I was having, but I kind of gave them an overview. So they put me in a room they let my mom stay with me. They were very nice, a lot nicer than what I thought they would be. I thought they were going to chain me up and throw me away, but they were very nice. And the doctor came in, and this wasn't a psychiatrist. This was an MD who worked in the hospital, and he sat down, and it was really busy that day. I remember just thinking, wow, the ER is really busy. We're going to be waiting a long time. I'm just going to leave. I was starting to chicken out, and he came in and took the time to sit down across from me, look me in the eye and say, "Addie, what is going on? What happened to you? Tell me what's happening." And I was able to do that. And he gave me his attention for 10 to 15 minutes. For an ER doctor, that's a big thing. And I was able to tell him what was happening very briefly. Starting from my childhood, I told him about the checking and rechecking things that I shared with you. And after all of that, and after just diarrhea of the mouth, basically, he smiled at me and he pats my shoulder and he says, Addie, he's like, I just want you to know that you are not crazy. You are not a bad person. You are not dangerous, but you have obsessive compulsive disorder. And you know what? We can treat it and we can make you better. And I just remember that was one of the people, that doctor was one of the people that saved my life that day, because he affirmed and validated what was happening for 20 years. This had been happening in my life, and I didn't know what it was. And for the first time, someone of authority and someone who knew what they were talking about said, yes, this is real. You're not making it up. You're not a bad person. You have a mental health disorder and there's help. So that was kind of the changing point. I believe he saved my life that day. And another person was my mother. She was a nurse. She didn't know a lot about psychiatric issues because she was a pediatric nurse, but she took me to that ER. She demanded the doctor see me. She ruffled a lot of feathers. She was my advocate when I wasn't for myself. So those were the two people that kind of made that change possible. That wasn't the end of the struggles. The barriers, and this is something that I help folks with every day at the drop-in center that I work at, is the barriers from the hospital and then extending care are so tremendous. I went that day and got very limited medication, and it probably, thinking back, they gave me PRN medication, but they couldn't give me anything substantial because I needed to see a psychiatrist. But the psychiatrists were booking out for months. So I was looking at 2 months before I found some kind of relief. Also, therapists were booking out for weeks and weeks and weeks. So that was another barrier from the time I entered the ER. And then from the time I actually stepped into a mental health facility to get that support, there was months of limbo where I knew there was hope. I knew that there was help out there, but I couldn't get to it. The system was so bogged down and so saturated with patients that it was months. I also had to get tested. I took the psychological test on the computer, on the paper. I talked to a psychologist. That appointment was weeks out. We just wanted answers and we just wanted some relief. So those barriers were really quite a struggle. We also had to discuss with our insurance what medications will they cover and what won't they cover. And we had to talk about the barriers of family. And while I wasn't getting treatment, and I had hope, I still was agitated and frustrated, and it took a toll on my family and on my marriage while we were waiting for help. So those are some barriers that were really serious for me and for other people. People in the recovery world, if you're a peer specialist or a therapist, social worker, you'll know about the 5 stages of change model. And I believe at this time, when I was in that ER, is when I felt that little light in me, that flicker of hope, that change. That was the stage I was in there. But it took time to get to those services that I really needed. So what helped? A lot of people ask me, listen, if you could tell the people that were around you anything, what would you share with them? So I kind of made a list of things that really helped me, that maybe would help other people who are going through the same thing. The affirmation of my diagnosis and my illness changed my life. It saved my life. Knowing that someone actually understood what I was going through and didn't judge me for it, that was huge. The second thing is education about the disease. I didn't know anything, and I think what almost resulted in me ending my life and the hopeless feeling I felt was simply because I was not educated. My family wasn't educated. We knew nothing about this disease. We had watched TV series about it, and it was funny, and people would joke about OCD, but we didn't know anything about it. So that education and misinformation about the disease nearly cost me my life. So I found that the education about the disease is really important. Third is therapy. So being a social worker, being trained as a therapist, therapy is my favorite thing. As I said, it took a while from that visit to the hospital to actually get into services. The system was really slow, but when I finally did get into a therapist, it changed my life. It was absolutely amazing. I remember it's been so long now, so I can say my therapist's name. It was Kevin, and he was an LPC, and he didn't specialize in anything. He wasn't like an OCD specialist or anything like that, but he really got it, and he really understood, and he really understood my intrusive thoughts, my obsessive thoughts, and he really understood the concept of how the spirituality really fed into my obsessions. So he really worked with me. The therapy models that I found really helpful were cognitive behavioral therapy. Once I started medication, I was able to really grasp on that cognitive behavioral therapy practices that he would teach me. We also did a lot of exposure therapy. He made me cook for people, and I didn't want to do it. But it was the only way that I was going to get used to sitting with that anxiety I had about germs and contamination and stuff like that. We also very just kind of touched on DBT, but he wasn't a DBT therapist at the time. But I just remember going, listening to some of the acronyms and just using maybe some of those skills. So that is what I found helpful in therapy. And then, as I said, medication. So medication's a very tricky thing. Some people believe in it, some people do not. It's very subjective, and some people have very personal opinions about should you take medication, should you not. So from my perspective and my lived experience, I can say the medication really helped me. I took a really generic, tried and true SSRI, and it really quieted the obsessions and the compulsions and the anxiety long enough for me to be able to use coping skills, use my support systems, use those skills I was learning in therapy. For myself, I found it really helpful. And then finally, peer support. So I had my family, I had my doctors, had my therapist. They were all great. But this is when I kind of stepped into the peer support world, kind of like the NAMIs and the consumer operated service providers and peer specialists. I was in my undergrad at the time, and I had decided, you know what? I want to learn more about this, so I'm going to go learn from people who've been through it. And I found such a magic in peer support, walking into a room with people who actually understand what you're going through and understand that you're not alone was very helpful in my recovery. So all of this kind of led up to me beginning my social work journey. I learned that I wanted to have the answers. I went 20 years without answers about what was happening in my brain. And I wanted to be able to answer these questions for other people. So after my undergrad in human services, I got my master's in social work. And I focused in clinical social work and mental health. I worked in community health settings. I've worked in inpatient psychiatric settings, but my favorite setting is peer support. That is where I feel like my talents are best used. So that's what I like to do. So, something I learned stumbling into strength and stumbling into talents I didn't know I had because of my mental illness, I learned that recovery is possible. In the darkest moments of my life, I didn't know if I would make it or not, but I did. And now, on the other side of this, I get to work with people who are so resilient and courageous and going through so much more than what I ever could go through. And I get to work with them and walk alongside them. So I've learned the concept of recovery. And with mental illness comes recovery. There is change and hope is possible. I also learned that I had something to offer. So for the first 20 years or so, since I was 7, 8, the OCD had told me that I was a sinful person, that I was a terrible person, that I was a sick person, that I was crippled, that I was ugly, that I had nothing to offer, and that I didn't matter. And what my recovery journey has taught me is I do have something to offer. And other people have something to offer, other people who are going through the same thing that I am. And my recovery made me realize that just a little bit of hope for other people may save their life. So I was grateful, really still am very grateful for that. And I also needed a purpose. For the first 20 so years, dealing with anxiety, dealing with the OCD and the panic attacks that came with it. I had a lot of symptoms that overlapped. My OCD was like the nucleus for so much anxiety and panic attacks and agoraphobia. I was homebound for about 5 years because my OCD got so bad. I couldn't even walk to my mailbox. So it had controlled me. It had controlled me to the point where when I stepped into recovery, started taking meds, started seeing a therapist, my mind started to kind of go, what's going on? Why aren't we being controlled by obsessions, and why aren't we doing compulsions? I kind of was shocked the first year that I was going through recovery. It was a really big struggle because all I had known for years and years was to listen to the OCD or something bad would happen. So now here I am. It's not controlling me anymore. What do I do? What do I do with my brain and my life? And what do I do with the time I have now that I'm not performing rituals? I could go to work. I can go back to school. I can actually enjoy being a mom. There's so many things, but I needed a purpose. And it was very easy. Years down the road into recovery, I really struggled with the wasted time. I was so sick for all those years, and I was so debilitated by OCD. And I got kind of angry about that. And I kind of fought that a little bit. And I was like, that's not fair. Why did that happen to me? Why me? All those things kind of went going through the grieving process. So I needed a purpose. And this OCD gave me the purpose to help others. It is what propelled me into social work. It is what made me who I am today. I am determined now more than ever that I must be the light to people who don't have any. When I was going through it, I didn't have anyone. No one told me this was okay. So the purpose now is to educate other people that they have a purpose. So it kind of gave me a whole new lease on life, I guess you could say. So I kind of shared a little bit about my career as a social worker. It's tricky. It's tricky being a social worker and sharing your story. We call it therapeutic use of self. And in training and in your studies, it is very a fine line. Do you share? Do you not? So I started in the human services field. And as I said, I worked in community health, inpatient psych, peer support's where I ended up. And I have the opportunity now to work as a social worker and still share my story. And if I'm speaking to other social workers who are struggling with that, that's a real thing. It is a struggle, but it depends on your agency. It depends on what they allow, and it depends on what's therapeutic, what is going to help, what is going to be the best thing for the people that you're serving. Fortunately, I have the ability to share my story and be a social worker, so I feel like it's a win-win. Also, in my career as a social worker, I work with a lot of students. I'm the field supervisor for all the students that come through the agency that I work for. And I feel like my goal, kind of going back to the purpose, my goal is to make future mental health care workers better, stronger, more empathetic, more compassionate, more in touch with what's actually going on with the people they're serving. So that's a really big passion of mine. I love working with students, undergrad students. I work with occupational therapy students, nursing students, psych students, social work students. And no matter what the profession is or the discipline is, I find that me being able to help them see it from a peer perspective is making our mental health system in the future just that much better. I am considered a community-based social worker, so I don't do therapy. I don't do any of those clinical things, though I use my skills all the time. I am very much, I have to kind of design my practice into the peer support world. And it's a challenge, but it's also a very great privilege to be able to do. So where do we go from here? A lot of people ask me that. I ask myself that every day. And there comes a time when you've been in recovery, or you're just starting recovery, or you're still on that journey. What do we do? Where do we go from here? What's the next step? For me personally, my next step is I will continue my story. I will live a life full of curiosity and remain teachable. I love hearing other people's stories of resiliency, and I love meeting people that have fought against all odds to come and walk into my office and say, I'm going to survive this. So I love to remain teachable, and I learn things every day. As I said, I will educate others about mental illnesses and disorders. And as I said before, I feel like the one thing that almost destroyed me was the lack of information and the lack of education. There was no ill will. There was no one who was out to get me. There was no one who ever meant me harm. It was all just misinformation and the lack of education. So I believe in educating ourselves and other people about mental illness. I will advocate for others who can't speak for themselves. I work in an atmosphere where we promote self-advocacy. So I hear people advocate for themselves every day. I am taught to advocate for myself every day, but not everyone has that. Not everyone is at that point to where they can advocate for themselves. So it's up to us, me and you, to advocate for those who can't speak up for themselves, even if it's just speaking to them and affirming them and validating them. That sometimes is enough to save a life. I will continue to serve as a social worker and as a peer and as someone who is dedicated to changing how we treat mental illness and how we look at those who have mental health challenges in our communities. Mental illness in itself is taboo. I do a lot of talking in my community to professionals and healthcare workers and a lot of people about the impact of mental illness on our society. 1 in 5 adults experience mental illness. 1 in 25 adults experience serious mental illness. That means their lives are affected. They lose their jobs. They lose their homes. They may struggle with chemical dependency, trying to mask the symptoms. So 1 in 25, that's a lot. And it takes a person on average 7 years to seek help once they have the onset of symptoms. It took me 20 years. From the age 7 to 26, 27, I kept my symptoms buried, and I suffered in silence. That's too long. Any time is too long. Suicide is the second leading cause of death for people ages 10 to 34. That could have been me. It could have been my son. I have a son who has obsessive compulsive disorder. That's a huge statistic. Suicide is the 10th leading cause of death in the US. A lot of those folks are people who have mental health challenges and maybe just didn't get help in time or maybe felt hopeless. And finally, 1 in 40 adults, about 2.3% of the population, or 1 in 100 children have obsessive compulsive disorder. I'm one of those statistics. My son is one of those statistics. And these children, just from personal experience, are going through something that's not a funny quirk. It's not a joke. It's not just being really clean. It's a serious debilitating thing that's happening inside them. So, in closing, as painful as it was and still sometimes is, if it were not for OCD, I would have never found this profession that I love so much. I love social work. I love being a social worker. I love the skills and I love learning about people and their experiences. If it weren't for OCD, I wouldn't be able to advocate for my son, as I said, who also has obsessive compulsive disorder. If it weren't for the experience I went through, I wouldn't be working where I am today. And now am an advocate for those people who come into my office and feel so hopeless and alone. I also wouldn't be able to teach students and future healthcare workers about mental illnesses if I hadn't been through it. And finally, I don't think I would have made as much of a difference. The pain that I felt and the things that I went through really propelled me and pushed me to keep going and to make a difference. My favorite quote, and this is a picture of me at my graduation and my dad and my husband, who were kind of the building blocks, the staples of my life when I was going through this, along with my mother, but by Alexandra Ali. And she says, "I am thankful for my struggle because without it, I would never have stumbled upon my strength." And I think that for all of us who have struggles, whether it be mental illness or anything else, that we kind of just stumble, right? We stumble into the strength and into these talents. And I just encourage everyone to listen to them and to embrace it and to make it mean something. It doesn't have to be a waste. I'm so thankful for the opportunity to have shared my story and to share about a little bit about me during this presentation. I want to remind everyone, recovery is a journey. It's a marathon. It's a very windy road. Some days we're going to be doing really good, and some days we're really, really going to struggle. But the point is to keep moving forward, and then hopefully we'll come across others and come up beside others, share our stories, and hopefully give them the hope to keep going. Thank you so much for your attention and for listening, and I hope to hear your story one day. Thank you.
Wow. You know, what else can be said? What an amazing story. What an amazing journey that she has been on, and just an incredible speaker to be able to share that the way that she did. That that was just truly impactful. And I can tell that everyone in the chat was equally and genuinely impacted by the story that she shared. So
absolutely. I mean, my reaction was just, wow. I mean, just incredible. The power behind her story. I can't even put it into words. I mean,
right.
Look at the notes I took during your presentation, Addie. I mean, it was just, wow. Really incredible.
Hi. I was trying to see where I was. Hello.
You're here. You are with us. And we are so glad. We were just commenting on just how absolutely incredible your presentation was and how so very thankful all of our participants are that they got to participate and hear your story today. You have made a world of difference for a lot of people. Yeah, go ahead.
Oh no, I was reading the questions here.
Good. Yeah, let's jump into some of those.
Yes. Go ahead. Yes.
One of the first ones that I saw was, were you scared about taking meds because of past experience?
It was more of past misconceptions. I came from a culture that medicines were a last resort, and I also came from a culture in my family where we didn't have money to buy a lot of medicines. We didn't have insurance, so medication was always the last resort, and that was kind of just pre-programmed in. And I was kind of scared because of things that people had told me, like it'll change who you are, it'll make you this way, it'll make you that way. And so I was very scared, but I had never taken medication before in my life.
Okay. All right. There was another one about asking about becoming a peer specialist. Any recommendations you have on how someone would start down that path?
Yeah, so something that I would suggest, I waited a little bit before I kind of got on my feet in recovery and really, now this is just me personally, everyone's different, but for me, I really got stable in my treatment that was helping me. But part of that treatment was going on and getting my peer specialist. That process made me grow so much. So I would encourage people to believe in yourself and don't think that because you may not be where you think you should be, that's not a reason not to go get it. It helped me in my recovery, and it really made me realize things about myself that helped me be better.
Awesome.
Great.
Got another question in regard to your son.
Yes.
And of course, just oodles and oodles of accolades to you, just all up and down. The question about your son, was your son already showing signs of OCD prior to your diagnosis? And then two, how has it been raising your son who has OCD as well as your other children while also coping with OCD yourself?
So I think, looking back, I didn't know what was happening in my own self, so I didn't notice it in my children. It was one of my twins who has that diagnosis, and so I didn't notice it in him. But I also didn't know what was happening in myself, so I'm not quite sure if he was exhibiting those symptoms at that time. Now, how has it been raising him? I'm just thankful that I was able to go through what I did, because it's made my advocacy for him so much more powerful. I was able to go to school and say, listen, this is what's happening. I know because I have been through it. And it's been also with my other kids, just educating them. Why does Big Brother feel this way? Why is he doing this? And I'm able to really give that information because I know exactly what he's going through. So I am just very thankful, if nothing else, that because of my own experiences, I was able to advocate and still advocate for him.
I'm going to scroll down through here and see if there were any more questions. I know our production team is helping us keep track, because I did see quite a few pop up as we were going through. people just, and like Deb said, I mean, just the outpouring of support for your story in these
Oh, I'm
comments.
so thankful.
I
So,
hope you have a
so
chance to
wonderful.
read through some of this, because people are just overwhelmed by what you presented. I know I was personally too. So
Oh,
thank you so much for your story.
oh, I'm so thankful.
And I think what we're seeing also in the chat is you've really empowered a lot of people who also have OCD or perhaps other mental illnesses, that they're feeling like, I can talk about this now. I
Yes.
need to find someone to talk to about this now. And so you have definitely made your story very relatable to many, many people that have joined us today. And I think it's not understated to say you have changed some lives today
Oh, I'm
with
so
your
thankful
message.
for that.
Yes, absolutely. And it's just really encouraging and exciting to see the great takeaways that people who have joined us today are getting from what you have shared. Just a super, super job.
I could not agree with that more. Very powerful. And congratulations to you for overcoming all of that and getting victory over it. I think that's incredible.
Yeah, and I think it's important that people realize that it's a lifelong journey. So it's just something that we do every day, and some days will be bad and some will be good, but ultimately there's hope. No matter how dark the day is, tomorrow has the potential to be very beautiful, and I just want people to never give up hope in that.
Absolutely.
I noticed earlier on too, someone also mentioned that they too struggled in a family that was very faith-based, very religious. That it just wasn't something that was sort of talked about and accepted and that kind of thing. So you know that hit a home chord with several people. And while most of the time you think of having faith as something that is such a positive influence in your life, but as you've explained, sometimes it can be a challenge if you kind of let it be a barrier to actually getting the help that you need.
Yeah, I think it's faith is so important to me now, but I did have to work through a lot of stuff because sometimes sometimes our cultures and stuff make it kind of hard to move past it. So and religions, and it can be a beautiful thing, but we can also acknowledge that it can make things difficult also, maybe just because we don't have all the information or education. So it's just about self-empowerment and your own journey. Because I am a person of great faith, but I did have to work through a lot of yucky stuff. So that's not, it happened to me. So someone else must have been going through it too.
I think they were. I think it really touched their heartstrings to understand that they weren't the only ones that struggled with that at some point.
Yes.
Absolutely. I'm trying to see what else we have. Another question. Did you fight medication management at first, or did it work for you at the very beginning?
The certain medication that they put me on took a while to start working. And there was also some trial and error period where they gave me some medications that just didn't work, and I had to start over and start a new one. So at the beginning, it was very frustrating. And I was like, I just want some relief. Where's some relief here? But I found through support of my family, because my mother is a nurse and my husband was an EMT, with that support, I was able to stay I was able to stay on my medication schedule and find a medication that was right for me. And it eventually made all the difference in the world for me. there was a little, it was bumpy at first, but after a while, it really made a difference so that I could use all those other coping skills that I was learning.
As Bruce commented again, he was the one that actually asked the initial question. Sometimes it does seem to be a little bit of a battle to develop your trust,
Yes.
even as to which ones work for you.
It can be, and it can be grueling, and it can make you feel not good, and it can be really, really tough. I can definitely see in my own experience where I had trouble trusting the process.
Do we have any other questions for Addie today? Please pop them in the chat for us. And we are coming up on rounding off our time with Addie today, but I know she would love to hear from you and answer your questions while she's with us. Of course, you'll still have an opportunity to ask questions of Maddie. If you think of something after the fact that you wish you'd put in there to ask, we'll be sure and get those questions to Addie so that she can get back to you and share her information. So.
Yeah, I'm not seeing anything else pop up except for that you're awesome and your presentation was great. And
well, I'm very thankful. I know that I'm just one story in a million. So I know there are people out there who are so powerful and beautiful. So I just want to encourage them that that they need to be here to tell their story too.
Absolutely. Wow.
Thank you for your bravery and your grace and just the ability to have an impact on people's lives just by simply sharing your story. Thank you so much.
Well, I appreciate the opportunity. Thank you.